I'm a nurse. I've been a nurse since 1993, and I've worked in public health since 1996, and my current position is a public health nurse manager for the Lenawisco Health District, which includes Lee County, Scott County, Wise County, and Norton City.
All right, so you get out and about a little bit.
A little bit. You could say that.
Where's home?
I live in Wise.
Okay.
Actually, I just live about a half mile from here.
Okay, and is your family from here? Or?
My family is from here. Most of my family lives here. I have a few relatives that live in Florida and out west in California.
Do you have a long family history associated with the area? Or?
Yes, I do.
Yeah, that seems to be the story for a lot of folks here.
That's true.
So let me begin by just asking you, if you hear the word diabetes, what comes to your mind? What's the first thing that you think of?
I guess probably the first thing that I think of is the fact that so many people don't have a clear understanding of what diabetes is and of kind of more of the long-term complications or effects that can result from diabetes. I think that's the first thing that probably enters my mind.
And what's been your personal experience with diabetes?
On a personal level, not related to work, I don't have a whole lot of experience, but my mother was diagnosed with diabetes about 4.5 years ago. She had a heart attack, and she was in her late 60s, and she's still living. She's in her early 70s now, but she had a heart attack, and around the same time was discovered that she had diabetes. And so my experience has just been with helping her to understand what diabetes is and what she can do to lower her risk of complications and keep her diabetes under control as much as possible.
So she went to the doctor when she was diagnosed and came home. Did she seem to have a good understanding of the disease and what she needed to do?
Not really. To think about it, there haven't been. I can't think of anybody else in my family that's ever been diagnosed with diabetes, either on my mother's side, maybe some distant relatives on my father's side. So I don't think she had any personal experience with diabetes before she was diagnosed. So I think it took a bit for her to kind of understand. And actually, she's probably still learning about diabetes and what it can do and how you control it.
So was she lucky in having a daughter who's a nurse who could help her a little bit?
Well, I definitely think that helps. And my parents are, of the generation, they're in their early 70s where, when you go to the doctor, you don't necessarily ask a lot of questions, or you don't necessarily know what questions to ask. So there's been a couple of occasions where I've accompanied her to the doctor, especially since her heart attack, just to make sure they're asking questions and getting the information that they need.
And what kind of questions do you suggest that she ask?
I try to help them make a list of questions, especially if it's been like a while since they've been to the doctor or something new comes up. Questions about medication, or questions about when was the last time you ran this test, say like a hemoglobin A1C or whatever, and what was my result, and what exactly does that mean, and is there anything I should do differently? Those kinds of things.
Mm-hmm. Do you think that I'll get you try not to get you in trouble here, but just in general,
Okay.
do you think that the local physicians really give enough teaching to their patients?
It's just like any other thing. I think there are some physicians that do a great job, and then there are others who maybe could do a little bit better. And I know there are a lot of variables around that, depending on their caseload and how they're scheduled and all that kind of thing. But I do think it's really important to get the word out to just individuals in our community about their right to ask questions and to have their questions answered about their medical conditions.
I think that's an excellent point. Yeah. As a clinician and in working through the health department, do you see folks with diabetes?
In the past, we used to do some pretty big, what we called our general medical clinics that would be adults, primarily females, but sometimes males as well, that would just come in for primary type care. Probably in 2006 or 7, we no longer provided those services because of just funding and different things like that. And it's not a service that we're mandated to provide. So we used to see more than we do now, but we do have a program now for women between the ages of 40 and 64 who are in our EWL program. It's a chronic disease screening and diagnosis program. So we see some women through that program. It's called Wise Woman, who have diabetes.
Wise Woman sounds Native American.
Wise Woman is an acronym, and I apologize, I cannot remember what that stands for right now, but it's something to do with screening and chronic disease. I'd be glad to get you that information.
I think I can find it. Yeah,
Okay.
every time I hear that, I'm like, well, that sounds.
It does.
Sounds like Native American, and
Yeah.
I don't know if it's a Native American program or not. But
It's not.
Yeah, it just sounds.
It's just an acronym.
Yeah. What do you think causes diabetes?
Well, I think there's a combination of things. I do think there is sometimes a genetic role that plays in developing diabetes, but I also think sometimes it's an interaction between genetic predisposition and environmental factors such as diet, lack of exercise. Definitely obesity is a major contributing factor to diabetes.
Mm-hmm. A lot of communities are having a fair number of overweight children and obese children.
Mm-hmm.
Do you see that here in the county?
Absolutely. We have some of the highest rates in Virginia in our area. And through my work with the health department, we're involved right now with several initiatives to address childhood obesity prevention and intervention. And it's a really exciting time because a lot of the programs we're working with kind of seem to be following the same track and going down the same line of thinking with childhood obesity prevention to prevent long-term chronic disease as children and adults. And we're seeing more and more kids with, higher blood pressures and higher blood glucose and even higher cholesterol. So it's definitely an issue that's affecting our area in a big way.
What do you think are the risk factors in the community that might contribute to that?
Well, I think in our area, probably part of it is due to lack of education and also maybe just tradition in the way that we have grown up learning how we eat and how we learn to eat. A large part of it too, I think, is that if our children are not involved in a sports program, say like with school, there's not a whole lot of opportunities for individual type, exercise or recreation in our area. There's a small number of gyms. There's not really what you would say like YMCA's, or even some towns don't really have a park and recreation program. So I think just getting kids kids don't play outside like they used to either. There's so much technology. They're much more interested in computers and video games and phones and things like that. And so I think all that has played into our increased rates of childhood obesity.
Do you see concerns around nutrition as well?
I think so. And I know this is not native to our area, but families are so busy. Busier, I think, than probably ever. And, families used to have a large number of kids, and they all seem to kind of help each other and work and different things. And families do seem to be having smaller numbers of children, but with all the activities and things that kids are involved in, families are on the go. And I think there's a lot of eating out and a lot of processed meals and things like that. And of course, all that is not as healthy for you as eating fresh foods or eating at home and those kinds of things.
Can you share just a little bit about concerns with processed food?
Well, just in my own personal experience, not really having studied anything at work, I've just noticed in trying to be healthier with my family, when you look at processed foods, even foods that say like healthy choice or lean this or that, there's so much more sodium in those processed foods. There's so much additives that we don't really know the effects of a lot of those. And sometimes there's a high content of fat and different things like that. So Whereas if you are cooking at home, you're able to cut off fat, or you know what you've added to your food. And with processed food, you really are not entirely sure what's in there.
I sometimes tell people if you can't pronounce it, you probably shouldn't be eating it.
Exactly. Shouldn't feel comfortable eating it.
Yeah. A couple other concerns that I have as I'm kind of looking at communities is that it seems like a lot of families don't know how to cook.
I think that's true, especially what we say, like cook from scratch or cook with fresh products. They know how to heat things up and use microwave and things like that. But I do think you're right. I think a lot of families aren't sure how to cook some things that are healthier.
Or budget.
And of course we know fresh produce is more expensive than some of the other cheaper things that aren't so healthy that you can purchase and cook. And I do think that plays a part for some families as well.
Mm-hmm. Any ideas about how we could begin to turn some of these problems around?
I can tell you around childhood obesity a couple of things that we're involved in, and I'm sure there are other ideas and things that we could do, but one thing that we have been working on is helping low-income families who receive food stamps or SNAP benefits to be able to use their benefits at farmers markets. We've just recently through a grant, helped 2 farmers markets become certified to accept SNAP benefits. So clients can actually swap their SNAP cards at farmers markets, which sometimes have more reasonable prices on their produce. And the other thing is there's a program through local churches that families are able to sometimes buy or use their SNAP benefits to purchase not just produce but other food items as well. And we have a grant that we've worked with to help them use their SNAP benefits to purchase like a produce box through a program called Angel Food. And it's a really good price for a box of produce that can't necessarily be matched at a local grocery store. So I think, all the things that we're seeing are looking at towards changing your community and your infrastructure. Mm-hmm. It's hard for individual people to change their own behaviors, which of course is important, but if you can make it easier in any way by changing their environment, that seems to kind of be the thinking of most of the projects that we're working on right now.
Do you work at all with Extension?
We do work with Extension. We've worked with them in the past through our WIC program. They've actually occasionally helped provide some of our nutritional education, and then they've had programs that families have been referred to learn how to budget and learn how to cook and some different things. I know their funding has been cut just recently as well, so I'm not real clear on exactly what they still offer at this point. I think they had a pretty big cut as of sometime this summer.
And it's really interesting that that some of the things that could help the most are getting cut.
Right.
So the homemakers groups and teaching people how to cook often came through Extension and
exactly.
So now we'll have to find some other ways to do that differently than what we've done before. When you think about the disease of diabetes, what do you think are the most important things people need to do to control their disease?
Well, I think one of the things is that they need to make sure they're getting regular checkups with their physician, and that they are knowing what questions to ask and understand what their lab results mean and what they should do. I also think it's important that they know that there's simple things they can do in making changes in their diet or being more active to help keep their diabetes under control, things they can do themselves. Also in our area, there aren't that many resources for specialists. If we have an individual who could benefit from seeing, say, like an endocrinologist who's hard to control with their diabetes or something like that, they usually have to travel out of the area to be seen.
So there's no endocrinologist here in the county?
There's not one located here. Sometimes we have one that will be scheduled to come through like one of the health systems, but they're actually traveling here like just maybe one day a week or one day a month to see patients, but that's not on a regular basis. And we have had a couple of clinics through telemedicine with the University of Virginia health system, but again, those are just, they kind of depend on the availability.
Yeah. Was that effective, using the telecommunication?
Oh yeah, telemedicine, I mean, it can be very effective if patients, come and then keep their appointments with their primary care physician. I think it can be very effective.
Mm-hmm.
But like I said, there's not always funding for that or an endocrinologist available to do that.
Mm-hmm.
So
Yeah. We have some solutions, but they don't always work in rural areas.
right.
Quite challenging. Do you think that there are ways that families can best support someone with diabetes?
I would say probably, some of the best ways to support someone with diabetes is just to help them make sure they have all the current information that they can get, and just to talk with them about their diabetes and how things are going.
Mm-hmm.
Trying not to be judgmental or
Mm-hmm.
saying you should really do this, maybe trying to put themselves in their shoes. Try to be understanding of maybe the process they're going through.
Family members can be support, but they're also the ones that tempt us to, with
That's true.
have
Well,
a little.
that is true, because they feel bad for their family member if they think that perhaps they're not able to eat what they would like to eat and those kinds of things. And maybe one time it's not going to hurt, or one time a week, or even one time a day. And so I think when you have a family member who has diabetes that's decided to do what they can to control their diabetes, that we really should try to help them do that and stick to their plan.
And one of the interesting things that happens with diabetes is family members don't usually get educated.
That's true.
They often aren't, many times aren't at the visits and don't really hear what needs to happen.
That's right.
Have you had any experience?
I've not had a lot of experience with that on a personal level. We hear that, from our clients,
Mm-hmm.
our patients. We have heard that's the case, that they're, and even in things, like smoking cessation or whatever, they're trying to do what they can, but maybe they have family members who smoke, or like with diabetes, their family members are eating, sweets and carbs, and it's hard to be around all that, so.
You brought up tobacco, so let me just ask you a little bit about that. Is this a tobacco growing region right here?
Wise County, not so much, really, and I'm not sure about in the past. There's probably a little bit of that, but that's not one of the primary crops in our county. Surrounding counties, yes.
Okay. And it seems like some areas in Appalachia, because that's where a lot of tobacco has been grown in the
Right.
past, that people have different ideas about tobacco and their
Mhm.
use. Do you have any thoughts about that?
Well, probably not so much in regards to growing it, but I think a lot of the sentiment that we see with tobacco usage is, I've been using it since I was, very young. Actually, a lot of the adults who use tobacco have been using it since they were pretty much children. We see a lot of that, and so they think, all these years they've been using it, nobody's ever, the message hasn't been as strong as it is now about the risk of using tobacco. So I think maybe they can be a little skeptical about all that's coming out now around tobacco usage.
And working for the health department, you're trying to promote this message of quit smoking, reduce your smoking.
Absolutely.
No second
In every program that we do, we promote tobacco cessation.
And what kinds of things do people say when they hear that?
Well, one of the saddest things that we've seen recently is with the increased substance abuse in our area. When you talk to people about smoking cessation, it's like the lesser of two evils. Well, I'm on this road to rehab and recovery with my substance abuse, and this is not, nearly as harmful, and I'm going to continue to use tobacco so that I can get through this recovery with substance abuse. That's one thing we've seen a really on the increase lately. And then we always hear things like, well, I plan to quit at some point, but right now it's just not a good time. I'm under a lot of stress, or this is going on, or that is going on. So a lot of sentiment of, I'm going to do that sometime, but not right now. I'm not going to do anything about it right now.
Do you have people have any, because people have lung disease and family members die, and yet people still continue to smoke.
Right.
Do you see that here too?
I think you definitely see that. You know, I've seen the flip side of it as well. I have seen family members who had someone in their family die of lung disease related to cigarette smoking who have been successful at quitting. So I think you probably see both.
So it can be there is hope.
Can be a motivator.
Yeah. Do you see people actually successfully quitting smoking?
We do. I mean, it's not very frequent. It's not real, frequent, but we do see people who decide to quit and are successful at it.
So the biggest success is trying to prevent it in children?
Absolutely. I think that's the key, just as in anything else, is prevention. And we don't work with a lot of programs in our own health department around prevention with children, but we partner with other agencies that do, like our local community service boards and things like that. They're very active with smoking prevention with youth, and they do programs in the schools and different things, and we certainly support them and partner with them in any way that we can.
Has there been anything that you've seen that's really the most effective with young children? Because often the children have parents that smoke.
That's true. I don't know about anything that we've observed being the most effective, but I'm very curious to see the outcome of some of these new ads that are out on TV around how smoking affects your appearance and things like that, instead of so much focusing on the health effects, which the kids, they think they're going to live forever and they're never going to be sick. But they worry a lot about their appearance and how other people perceive them. So I'm curious to see if some of these newer ads around how smoking can affect your appearance will be effective or not.
Can you give me an example of what? Have you seen one of those? Or?
Gosh, let me think. Most of the ads are kind of sarcastic. Like, it'll show a group of teens maybe who are hanging out at school or whatever, and they all think this kid is cool or whatever, and then it'll flip and the kid smoking and everybody's kind of like backing away or won't have anything to do with them, and maybe they show the kid with like yellow teeth or leathery skin or something like that, and so they're kind of sarcastic, I guess what you'd say, ironic or sarcastic type ads.
But might be messages for children.
Right, for youth anyway.
Uh-huh. Yeah, that's very interesting.
Yeah.
Thanks for sharing that.
Okay.
Right now we're really trying to focus on prevention, and so there's several places in the community that seem logical to think about, and of course one would be school.
Mm-hmm.
Do you know about any efforts that are taking place here in schools to promote wellness with kids and activity and better nutrition?
Mm-hmm. I know that in Wise County, our school nurses are very active and interested in doing everything they can do and incorporating to their school programs. Several of the school nurses have attended our community and coalition meetings around chronic disease prevention. I know that they've applied for some grants, and I'm not sure what funding they were able to secure or whatever around childhood obesity prevention. And then we do a program in the schools, and we alternate the program throughout our district. So we may not always be in Wise County schools, but we do a program called Schools on the Move,
Mm-hmm.
and it's for we work directly with the kids to help them take a look at their nutrition, physical activity, healthy behaviors, and those kinds of things. They earn incentives along the way for completing things like food journals and assessments on, let's say, watching TV or being active. And it seems to be very well received with the kids as well as the staff at the schools and their parents.
How long does that program last? Is it several weeks or?
Yes, I think it's about 10 weeks. We go into the school once a week for 10 weeks. And we usually are able to see about 700 kids in a year's time. So
That's encouraging.
yeah.
Is tobacco covered at all in that program?
Yes,
It is covered. Do you remember what the program focuses on, how that is?
I'm not
You
sure.
probably haven't
to be
taught
honest
that,
with you.
yeah.
Yeah.
Are you doing anything with workplaces to prevent?
This past year, we did a program through the Virginia State Nutrition Office called Champion, and that's also an acronym. And there was one program for working age adults. I think it was from like 20 to, I guess, on up to 64, whatever, just the working age. And we partnered with work sites. We actually scheduled work sites, and we would come out and do this program with their employees who wanted to participate. And it was I believe, a 6-week program. And a lot of the same information that we use with our Schools on the Move, just around nutrition, physical activity, healthy behaviors. They also could earn incentives, but unfortunately CDC cut that funding, and we're not able to continue that program right now. It ends actually at the end of this month.
Is that right?
Yes.
And how many employers were actually using this?
I'm trying to think how many we served last year. I would say we probably served between 4 and 6 employers last year.
And how did they respond? When it was over, did they like it?
They were very excited about it. They were glad for their employees to have the opportunity to participate. We haven't tabulated all the data yet as far as the surveys and things that we did, so I feel like we probably have a pretty good positive response, but we haven't completed that tabulation.
When do you think that might be ready?
It has to be ready by the end of next month, because
Okay,
we have to do a report.
Okay, I'll be really interested to get the response.
Okay,
And
we get requests like that all the time, though. Employers want to know if we can come out and do a wellness program. We just don't have the funding, the staff, and the resources to do it without additional funding.
Yeah. As I've been talking with people, one of the things that seems to come up often is this idea of maybe churches could be a good way to bring prevention messages and health messages. Have you all worked with any in the health department?
We have. Throughout the years, we've had certain churches that have been real supportive in allowing us to use their facilities to do community meetings or educational programs and different things like that. And just recently, through one of the programs around childhood obesity, we've actually been partnering with Clay Morgan Chapel Church, which is where we are today, to help promote the Angel Food Program, the availability, affordability for families. They've been great to work with, and we also are getting ready to start a new project that's called CHAP, and that's around teaching individuals in the community to be health ambassadors for people that they know. So we're hoping to partner with several churches throughout our district to teach, I think it's to teach 10 ambassadors at a time to advocate for their family members, their church family, or anybody else they want to help advocate for around knowing more about health equity and disparities, how to navigate the healthcare system, what to ask your doctor, resources in the community, and that type of thing.
Oh, that sounds wonderful. And who's funding that?
This is funded through the Office of Health Equity and Minority Health with VDH.
Okay. So it's a Virginia program.
Yes.
Yeah, that sounds like a really good program. I'll talk to you in a little bit about something that I would like that I'm hoping to do as well.
Okay.
If you were going to make if you were going to give one message to people about the importance of being healthy and preventing disease, what would that message be?
What always comes into my mind when I think about prevention, of course I know genetics play a role, but the biggest thing that pops into my mind is, what you put into your body is what you're going to get, whether it's nutrition or exercise or whatever. It doesn't happen magically. It has to be put in order, for it to come out and be there. So I think that's the biggest message
So often people rely on us, nurses or doctors, to make them healthy.
Right.
But we're really not able to do that, are we?
We're not. I think about it like I think about, I worked with a program for a while with children who had disabilities. Their therapists, say physical therapists or occupational therapists or speech therapists, would come in weekly, but they couldn't really make a difference. What makes the difference is what the families decide to do with that information and take and do, because really their family is the therapist. And the same way, with individuals, we're there to support and help, but we can't be there all the time, and they have to take what information that they have, and they have to decide to make the change and be responsible for their health.
Really. And one final thing is that, a lot of concern around the idea that moms don't know how to cook and they're busy and families are not encouraging activity and all of those things that come around young families
Right.
today. Do you have any ideas or any suggestions about what families can do or need to do to make a change in their lifestyle?
I think families feel so overwhelmed sometimes, just thinking, maybe I do want to be healthier and incorporate some changes, but I just don't have the time or the resources. So I think helping them to see simple and inexpensive things that they can do that don't take very much time or resources, that can make a significant impact on their family's health. I think those are the key messages that families can benefit from.
Mm-hmm.
Keep it simple.
Yeah, simplify. I've been
Exactly.
thinking a lot about that lately.
Right.
How much do we really need and what's really important?
Right.
Yeah.
Keep it simple and change the things that we can change, and help families to make those simple changes that they can be successful with.
Mm-hmm. And then the other thing I like to always add is make it fun.
Exactly. That's true, especially for children.
Uh-huh.
Mhm.
Well, but it's not just children. I think all people enjoy things more if there's some fun.
Well, I think that's true, and everybody has their own idea of what fun is, and they just have to know what that is and how they can use that in whatever they're doing.
Maybe fun's not always the best word. Maybe it's meaningful.
Meaningful and maybe even enjoyable, even if it's not fun.
Eating those carrots sometimes isn't fun, but it's
Right.
meaningful maybe.
Yeah.
Yeah.